Hi, I'm Scott Rhodes, and I'm so thrilled to have the honor of presenting our work with transgender women. I'm part of a strong team of community and academic researchers who are committed to community-based participatory research. We have an established history in developing, implementing, and evaluating behavioral and community-level interventions for minoritized communities and populations. Today, I'm representing a strong team of community and academic partners who published an important paper in the American Journal of Public Health describing the outcomes from our most recent intervention known as CHICAS. CHICAS is an intervention designed to increase pre-exposure prophylaxis to prevent HIV infection among Spanish-speaking transgender Latinas. Pre-exposure prophylaxis is commonly known as PrEP. So before I get too far along, I want to recognize the Centers for Disease Control and Prevention for their support of this important work. CDC provided the funding for the development, implementation, and evaluation of the CHICAS intervention. Over the years, our partnership has had amazing successes working with CDC colleagues through cooperative agreements. CDC colleagues provide much added value. So we all know that transgender women are disproportionately affected by HIV. And unfortunately, PrEP use to prevent HIV is low. To address the low use of PrEP, our community-based participatory research partnership in North Carolina developed, implemented, and evaluated CHICAS. CHICAS is designed to increase PrEP use among transgender Latinas. In addition to PrEP use, CHICAS is designed to increase the use of condoms and medically supervised gender-affirming hormone therapy. Our CBPR partnership had previously learned that some transgender women do not have good access to safe gender-affirming hormone therapy services despite their interests in such therapy. CHICAS is designed for Spanish-speaking transgender Latinas who have sex with men. The intervention is informed by social cognitive and empowerment theories, is delivered in 2 sessions, is delivered in Spanish, and is delivered in small groups of transgender women. Before the COVID-19 pandemic, CHICAS was delivered in person, but during the pandemic, we pivoted and delivered it virtually using video conferencing. So CHICAS addresses knowledge of HIV and knowledge of sexually transmitted infections and their prevention, and of medically supervised gender-affirming hormone therapy. It is also designed to demystify how to identify and access local resources and increase self-efficacy to overcome the multitude of barriers transgender Latinas face when accessing services. The intervention builds communication skills, increases understanding of sociocultural contexts, and it strengthens relationships and a sense of community among trans Latinas. It is important to note that we did not provide PrEP. Instead, CHICAS was designed to build skills among participants to seek and successfully obtain PrEP within the community. And I want to emphasize that building community capacity to address health equity is an important strategy within our CBPR partnership. On the right, you see photos of our 3 interventionists. We found that a combination of interventionists seems to work well. We had a transgender Latina interventionist, a cisgender Latino gay man, and a cisgender white woman. Lucero and Jorge are native Spanish speakers, and Lily is fluent in Spanish. So CHICAS was led by a project-specific steering committee. This committee provided guidance on all aspects of the trial, including trial design. While this committee did a lot, I want to highlight the committee's work to problem-solve emergent challenges, such as how to adapt the trial and the intervention to the COVID-19 pandemic. Here are a few photos of our CHICAS steering committee. In this trial, we screened and recruited 144 HIV-negative Spanish-speaking transgender Latinas. They were randomized to the CHICAS intervention or the delayed intervention waitlist control. Participants completed assessments at baseline and 6-month follow-up, and follow-up retention was 94.4%. Now, this is an extremely high retention rate, and it's a testament to our steering committee, the insights, and the trust our team and partners have within the community. For our primary outcomes, we use multivariable random effects logistic regression modeling that adjusted for potential clustering. Here are a few photos from Chica's in-person implementation. You see it's very activity-based. And this is a photo from virtual delivery of Chica's. Often, participants use their phones to participate, which works well, but our team had to help participants understand how to use video conferencing. These photos are from a graduation ceremony from in-person delivery. And finally, this photo with a few participants modeling the Chica's bags that they received as a gift. Let's look at baseline demographics. Of the 144 participants, there was a mean age of 33, 65% were employed year-round, 80% reported earning less than $2,000 per month, 63% were from Mexico originally, and this reflects our part of the U.S. South. 50% reported less than high school educational attainment or GED equivalent, and 70% reported speaking only or mostly Spanish. In terms of outcomes, we were pretty happy. Current PrEP use significantly increased in the intervention group compared to the control group, though past 30-day consistent condom use among those reporting sex and current use of medically supervised gender-affirming hormone therapy did not. Significant differences between the intervention and control group were identified for HIV knowledge, STI knowledge, gender-affirming therapy knowledge, PrEP awareness, PrEP knowledge, PrEP use readiness, condom use skills, and community attachment. Developed using a CBPR approach based in the real-world experiences of transgender Latinas and informed by theory, Chica's offers an urgently needed efficacious resource to reduce HIV risk through PrEP use. Chica's is the only efficacious PrEP promoting intervention included in the CDC Compendium of Evidence-Based Interventions and Best Practices for HIV Prevention. Currently, our team is working with Sentient Research to package Chica's for Spanish-speaking and English-speaking transgender Latinas, and to adapt and package the intervention for African American, Black, transgender women. So be on the lookout for this new intervention called Sisters United. It's been my honor to talk through our CBPR partnerships, Chica's intervention. Please feel free to reach out to me with questions or ideas. Thank you for your time.